Welcome to the Partovi Effect, creating the consensus. I am Mrs. Madi Partovi.
And I'm Dr. Ryan Partovi.
And there are a couple of thoughts that I'd like to get out before we begin. And one of them is that the CDC is recommending 3 COVID vaccines for babies from 0 to 9 months. It's absolutely shocking to me.
Is it though? Is it really shocking to you? Or is it more disturbing?
It's disturbing.
Yeah.
I think it would be shocking that if there were any moms and dads that would actually follow those guidelines.
Hmm.
Don't do it, moms and dads.
Well, this is not medical advice because she's not a doctor, so you don't have to worry about that. But she's giving her opinion, right?
I'm giving you my biased opinion
Yeah.
based on, the people that reach out to us that are vaccine injured,
Right.
Including children.
Well, I guess I'm not shocked because I know I am very comfortable and familiar with the depth of the gaslighting of our corporate media right now. And, 75% of all ad spend on corporate media is from one industry, aka Big Pharma, it's not at all surprising to me that people who consume that programming all day, every day, like frankly, your parents and my parents and many people's parents would be advocating that. And there may even be some people in our generation who are still doing that. I don't know, but it's a good question. It's certainly not something we advocate for.
No, absolutely not.
Yeah, the FLCCC has actually basically signed on to the Hope Accord. I personally have signed it, which recommends the withdrawal of these vaccines, the mRNA vaccines, from the market, because our view as an organization is that the potential harms outweigh the potential benefits. And we could probably do a whole nother episode just on that. I don't really think we need to do that right now, but look it up, the Hope Accord.
Yeah.
Yeah.
All right.
Anything else you need to say before we get into our COVID update?
Well, I think this is a segue into it. One of our patients told us recently that treatment on day 1 makes this a vastly different disease than starting treatment on day, let's say, 3, 4, or 5.
Yeah. Well, I mean, that's something that I
Let me make that a little bit more
yeah,
clear.
I would say that's something I said to her.
Okay, yeah,
You
yeah.
know,
And she verified that.
yeah, she had the experience of that because she had previously been treated by us and probably started treatment at like day 5 or 6. And then she got a COVID prep package, which is our offering that basically allows people to have all their medicines on hand and get started with treatment on day 1 of symptoms. And so she did that.
Yeah, so if you're asking, how do I get started on treatment on day 1? Like, what do I need? How do I do it? And so that's one of the most valuable, offerings that we have.
Yeah.
Which is called the COVID prep package, in essence, because you are prepared for it. You have everything on hand. You have all the medications on hand. You can start them on day 1, and you're guided by our team. And you would definitely help them deal with anything else that comes up. Like we've seen secondary bacterial infections, and yeah, getting to 100 is not cookie cutter for everybody. It's
Right.
very individual.
Some people have reactions to the medications, and so we have to deal with that, and being able to discern, is this COVID or is this a medication reaction, is, something you gain from experience. And at this point, we've got a lot of that. So I would say having someone who's experienced following along with what's going on and accessible to you through the process is really crucial.
So, Dr. Ryan, will you please provide our community with a COVID update?
Right now, case levels are higher than they've been since February of 2022. So all of 2023, we never saw cases get this high. We're dealing with a massive surge in cases, and it's really at the very start of the season, which is not typical. Usually we see case levels peak in January, February, after everyone's gotten together for Christmas, which makes me concerned about what's Thanksgiving and Christmas going to look like this year, given that we're seeing such high rates. And there's some reasons to be concerned about that, which I'm going to get into in a minute. First, I'm going to do a screen share, which I enjoy doing to kind of do it all the time in our visits with patients, just to kind of show them what I'm seeing so that they understand. We're going to look first at some statistics directly from the CDC. And, some people have a tendency to say, well, CDC, corrupt organization, I don't really trust a word that a word that they say. I get that. And what I would just say is, it's what we have, right? there's not some sort of alternative yet. So we sort of, and if anything, I think their incentive would be to want to minimize it to some degree. So, you know, I think by looking at the numbers, we can kind of see that, things are likely even more severe than they're showing. And, they even say these early indicators represent a portion of national COVID-19 tests and emergency department visits. And then wastewater information also provides early indicators of spread. So test positivity, we can already see this graph doesn't only goes really back about a year. And you can already see that test positivity is up by 16.3% from last week, and definitely higher than it's been in the last year. Emergency department visits. The good news is emergency department visits are a little bit down from their peak last year. So I'll talk about why I think that is in a second. Hospitalizations also down a little bit, and deaths as well. Not as high yet, although they're still going up, and they're up 2.6% from last week. So, the question would be, why is that? And, I think that what I've seen in general for the last 4 years is that as people get COVID more and more times, their risk of death in the first 30 days actually goes down, because we're not seeing as high rates of pneumonia, and that fulminant COVID pneumonia that would really lead to lung fibrosis, clot formation, that kind of thing in the first 30 days. So you may ask yourself, well, okay, well then why do I need to bother with early treatment? So to really understand why this is such a unique time period, it's good to look at the variant data on the nowcast. So, what we can see here is that we have currently 4 variants sort of vying for dominance. And that's not typical. I would say usually there's 1 or 2 variants that are kind of the predominant variant, but it's atypical that we have 4 variants that are sort of competing. Now, the good news is that KP3 and KP3.1.1, who are genetically related, seem to be making up over 50% of the total. So they may be in the process of edging out these other 2 variants, LB.1 and KP2.3. But I think this is part of the reason why we're seeing people sometimes even get COVID and then again getting COVID, is because if you look at the genetic lineage here, you can see that LP.1 is coming from a little bit of a different lineage than the KP.3, and also, let's see here. Yeah, oh, that's right. KP2.3 also is coming from a different lineage. It's coming from the KP.2 lineage. They all have a common ancestor here in the JN1.1.1. But because they're sort of all breaking off at various points, I think that's why we're seeing that the sort of cross protectiveness from some of these variants is not what we normally would see. It's really not typical that we would see 3 distinct lineages all competing for dominance at the same time. I have not seen that before yet in the last 4 years. So it's kind of an interesting situation. I think that's what's driving the case rate so high. And I also think that, that kind of sets us up for a conversation about, so why do we care? If hospitalizations are down, deaths are maybe, or they're not down, they're up, but they're down relative to where they were last year, even though there's more cases. So why do we care? Well, really, for the last 2 years, the big issue with COVID has not been the risk of immediate death. It's been the consequences of COVID, specifically long COVID, long haul COVID syndrome, and COVID associated disease, which can be cardiovascular, can be neurological, and can be oncologic, can be cancer. So, we've seen a strong, and we have another episode where we've really delved into COVID and cancer. And I would say let's put that link somewhere in maybe on the screen and in the description. But, I think that it's important to remember that and understand that in somewhere between 25 to 33% of people, they're susceptible to developing long haul COVID syndrome and other sequelae, other consequences of COVID infection that sometimes, can last months to years. So, I think it's really, it behooves everyone to minimize their risk by treating early. The other thing I would say is that a lot of times we see that it's not with the first infection or the first dose of the vaccine or the first exposure to spikeopathy that many people develop symptoms. Often it's every single time you get exposed to the spike protein, because remember, spike protein is cytotoxic.
Whether by vaccination
Mm-hmm.
or getting COVID.
Right. It doesn't matter. Yeah. A spike protein is spike protein is spike protein is spike protein. And so whether you're getting it from the vaccine or from COVID, it's important to realize that the greater the cumulative exposure to this cytotoxic protein, the greater your risk of long-term consequences from it. And so every time you are getting COVID, you're getting exposed to the spike protein. Now, I will say this, the duration of treatment or the duration of positivity actually mirrors the duration of exposure to the spike protein. So if your goal is to minimize your spikeopathy, your spike protein associated disease, you want to be exposed to the spike protein as, first of all, as little spike protein as possible. Second of all, for as short a period of time as possible. And a lot of the treatments we're using in the FLCCC eye care protocol are treatments that have been shown to reduce time to viral clearance, which means they reduce the amount of time our body takes to clear out the virus. And basically what I would say there, reduce the time the body takes to clear out the virus. And so if you clear out the virus sooner, that means shorter period of time exposed to the spike protein, means less cytotoxicity and less risk of long haul COVID syndrome and other COVID associated issues. So that's really why we recommend early treatment. And early treatment is treatment within sort of day 1 to 3 of symptoms. I will tell you, as you had mentioned earlier, that the experience of our patients pretty universally has been it's a different disease when you treat day 1 of symptoms versus day 5 to 7 of symptoms, which if you reach out to us and you want treatment, we do that. We do active COVID treatment, but it takes, time to onboard you, for you to be seen, for you to get the medication. A lot of times we have to send them in the mail because local pharmacies are unwilling to fill certain medications on the FLCCC eye care protocol. Yeah, so certain pharmacies are not willing to fill, and so we have to get them sent by mail order. And so it takes time. And so a lot of times they're not getting treated until maybe day 7 of symptoms. And at that point, people can typically expect that it's going to take maybe until day 15 to 21 for their symptoms to be fully resolved, even with treatment. We have relatives and friends who choose not to get treated for COVID, which I think is madness. But I would say that they're often dealing with symptoms day 28 plus, and they sort of chalk it up to, well, this is normal. This is part of getting COVID.
I just want to be on the court about that.
Mm.
We just had family visiting. They told us that they got COVID a month ago, still had symptoms.
Yeah.
They slept through a lot of the weekend.
Right.
Chalked it up to, oh, I'm getting older.
Right. Well, and you're literally getting older. I mean, every time you get COVID, every time you get a booster for COVID, you are getting older because your cells are getting damaged. There's increased cellular turnover. Anytime you have cell death, there's increased turnover to replenish those cells that died. And so, and then at some point you bump up against the Hayflick limit. So you're literally getting older from the cytotoxicity. Hayflick limit is sort of the number of times the cells can divide before they're just done. It's the reason why humans typically don't live beyond 120 years old. So, yeah, I mean, I think that we really don't see the development of long COVID, long haul COVID syndrome in patients who are treated early. If you're treated day one of symptoms, typically it's a 3 to 5 day disease versus a 15 to 21 day disease if you're treating later, versus if you're not treating at all, potentially, 28 days plus, depending on, a lot of factors. And a lot of people feel like, well, I survived COVID the first 2 times I was treated. Why should I be treating the third time? A lot of times, I mean, we've had several patients that have come to us and they say, well, you treated me for the first time or first 2 times I had COVID, but this time I figured, oh, it wasn't that big of a deal the second time. Maybe I'll just not get treated the third time. And then here they are, day 28, coming to us with long COVID symptoms. And, it's
Young and older.
absolutely, yeah, it doesn't matter. I mean, oftentimes young people are, yeah, we believe that it's a genetic risk factor. We don't really know what that genetic risk factor is yet, but I would say that it's very typical for, we saw this with the vaccine. A lot of times people wouldn't have a reaction to some people would have the reaction to the first dose for sure, but there were many people who didn't have a reaction till the first booster or the second booster. And it's the cumulative exposure to the spike protein actually increases your risk of spikeopathy, spike protein related disease. And so every time you get COVID, your risk of having long COVID, long haul COVID syndrome, or other COVID associated issues, including turbo cancers, increases. And I think that's really, it's an important message. It's a message, it's like a PSA that I really want to get out there to the world, because I think not enough doctors, are aware of this. And even the ones that are aware of it, kind of like, they get it now so intuitively that they're sort of not even talking about it anymore. And I think we're just seeing it show up so often now with these elevated anti-spike protein antibody titers associated with complex chronic disease, which has been my bread and butter since, the day I finished residency. This is it's a totally new source of complex chronic disease that is being woefully underappreciated and underdiagnosed and underassessed even. So, we're here to sort of raise the alarm bells and also strongly, strongly, strongly encourage people, get treated early, obviously get tested. If your spike protein antibody titers have never been tested, that's crucial, especially if you have a new diagnosis since getting COVID or since getting the vaccine. Anytime in the last, 4 years, if you've had a new diagnosis, it's worth getting that checked. Anything else you want to say about why early treatment is so crucial? I mean, I would just really reemphasize again, I mean, it's a different disease. If you treat on day one, sometimes the symptoms never progress. You don't necessarily even get the chest symptoms. A lot of times, it's like a little tickle in your throat and you start the treatment and right away, and then you just sail on through. And I would tell you the other thing is that for those who are just doing ivermectin and thinking that's going to be enough, maybe it is from a preventive perspective, but in terms of treatment, these variants, we've seen that hydroxychloroquine is really the game changer right now. I don't recommend trying to go it alone with ivermectin. I think, doing the hydroxychloroquine makes a big difference. The last time my wife can't take hydroxychloroquine, I can. And normally men have a worse case. I was able to start treatment day one of symptoms and basically sailed right on through, never got a fever, never got anything that even interrupted my work. Whereas you had much worse symptoms because you weren't able to take the HCQ. So, I think that, the protocol works as a protocol, as our longtime patients will know that I love to harp on that. And I think that that's something that I'm just want to emphasize is that, doing all the aspects of early treatment is crucial.
Yeah. My mind wandered for a moment there thinking about, do you remember that woman who came from Brazil? She's a nanny for a short time.
Sure.
She told me the story about the Brazilian government lining up little public school kids and vaccinating them for COVID.
Mhm.
I just think humanity is on the brink of, you just mentioned, there's going to be so much arising out of this.
Well, and that does bring up two more important points. We now actually know, and this comes from a study that I believe was, it would take me a minute to find it, but suffice it to say, it was in a major medical journal looking at the risk of infection. Oh, it was from the Cleveland Clinic data. Yeah, the big Cleveland Clinic study that actually showed you're more likely to get COVID, especially the newer variants, with the more number of boosters you've received. So the more boosters you've received, the more likely you actually are to get COVID now. So this has definitely become a pandemic, which of course they say the pandemic's over, but that's obviously BS. It's endemic, but it's something that we're continuing to deal with, and it's now turned into a pandemic of chronic disease, or it's added to the pandemic of chronic disease that we're already dealing with. I would just say that, but yeah, the Cleveland Clinic study definitely showed that the more boosters you get, the more likely you are to get the newer variants. And, the other interesting thing about that is that, and people always wonder, oh well, but I mean, that's going to help me against long COVID, right? If I get boosted? Absolutely not. If anything, there's no benefit. And in fact, there's actually a slightly increased risk of all-cause mortality for those who get more doses. And that we've seen that, with the excess deaths, and people don't want to talk about that or pin it on the vaccine. And I understand that. It's not, it's hard. It's easy to show correlation. It's harder to prove causation on these things, but there's a plausible mechanism. The cytotoxicity of the spike protein was established in a study that came out of the Salk Institute in San Diego, California. And the interesting thing about that study is they had to change the title of the study like 6 times and reword it a few times because people were saying, oh, you're going to encourage vaccine hesitancy because the vaccine is spike protein based. And, the other thing I would say that points to what you're talking about and the importance of stopping the boosting is that the number of days that, or the time to viral clearance actually goes up with each additional dose of the vaccine. And we've seen that starting very clearly with Omicron, where the first patient I ever had who tested positive after day 10 was on the home antigen test kits, not the PCR. PCR, you can test positive for up to 6 weeks and it detects dead virus, and it's not, a lot of false positives with those tests. But with the home antigen test kits, typically by day 10, it'd be over. We were starting to see day 11 to day 13 positivity in patients who were fully vaccinated. Because when we started treating COVID, we were treating primarily only unvaccinated people. Those are the only people who were getting early treatment. But then it was around, I want to say, end of 2021, beginning of 2022, where we did start to see more and more people were vaccinated until it became, frankly, at least as many people vaccinated as unvaccinated in the practice. And we were starting to see people test positive, beyond that day 10. And in fact, average is 11 to 13 days for people who just got the initial 2 doses, and then potentially even more, 13 plus days, 13 to 15 maybe is the average of positivity in someone who's been boosted once. And then more boosters mean longer positivity. And we've seen in our own family, patients dealing with who've gotten multiple boosters. It's not everybody in the family, follows what I do or agrees with it. I have 5 doctors in my family, and I'm probably the only one who's on this line of reasoning. But yeah, so we've got a lot of family members who don't necessarily adhere to what we're doing, and that's fine. We're in good company on that front. Well, RFK Jr. and his perennial media coverage of his family's rejection of his campaign. I'm reminded of
Well,
that.
ultimately, it's not fine. And
Well, they're entitled.
at least here,
They're entitled
we
to
have
their
some
opinion.
semblance of
Yeah,
freedom of, will and choice.
sure. And what I mean by that is they're entitled to their opinion. I agree. It's not fine in terms of the consequences for their health is not fine. And, I love to quote Sebastian the Crab. Children got to be free to live their own lives, and that's the truth. So I think that we can put the information out there and we can communicate what we know, and people can obviously do with that what they will.
And that's what I will invite people to do. Like, how are you actually living your own life?
a good question. Yeah. Yeah, I mean, look, if whatever you're doing is working for you, great. If it's not, give us a call. So that's my general rule. There's a lot of people who can be healthy doing a lot of different things, but usually, I would say not even usually, I would say 100% of the time, if someone comes in and they're dealing with health problems, they're not doing what I would have wanted them to be doing. So I think that's really the key point there. But yeah, I mean, we're definitely seeing with the people who are continuing to get boosted, we're seeing longer and longer infections, which again means increased time to viral clearance, which means increased exposure to the spike protein, and which means more cytotoxicity, which means more damage and to the body and more long-term consequences of these repeated spike protein exposures.
I was
Did
actually
you?
wanted to read something
Okay.
that captures a lot of the emails that we've been receiving.
Okay.
Dr. Partovi, I wanted to reach out because I found your wellness center through the FLCCC. I'm 28 years old and have had COVID like 4 times. I did receive 2 doses of Pfizer at my family's request back in 2021 and have not felt the same since. This email came in September 2nd of this year, 2024. Years of not wanting to exercise because of heart palpitations and unexplainable anxiety, and I'm fed up. In 2024, I feel a lot better than before, but still some random chest uncomfortability.
Is this a male or female?
Male.
Yeah.
I want a professional with the same mindset as me to consult with as I continue on this road to recovery from the spike protein craziness. I want to try ivermectin based off of everything I've seen. With all that being said, am I in the right place to get treatment for this type of situation? I'd love to learn more. Yes, you are. And we're following up with him. We're getting emails of that nature several times a day.
Yeah. Yeah, I mean, look, I think that at this point I want to say, we could just take a look at it, because I don't think we've ever done this on the podcast before. There's a live meta-analysis. If you go to c19early.org, maybe .com, let me see here. All right, well, she can clip this while I look for it here. C19early.org, here we go. And you can see here efficacy versus cost for COVID-19 treatments. Ivermectin still remains the number one in terms of greatest efficacy for the lowest cost. And if we look specifically at the meta-analysis, live meta-analysis of all the studies on ivermectin, we can see here that 105 studies now, broadly beneficial effects, 81% reduction in cases, 85% effective by itself for prophylaxis, prevention, and early treatment, 61 effective. We've got if we just look at the randomized controlled trials, 52% improvement from ivermectin alone, 42% reduction in viral clearance. So if it's to the left of this middle line here, that means that it's effective. And the little bar that runs through the diamond shows you the statistical significance. So if the bar was kind of crossing the midline, we would say that result is not statistically significant. We can see an example of that if we look at Paxlovid. We see a lot of these results are not statistically significant. There's no statistical significant result if we look at the randomized controlled trials in Paxlovid on mortality, on improvement, even progression and recovery are not statistically significant results. Cases, not a statistically significant result. We have a non-statistically significant increase in risk of getting ventilated if you take Paxlovid, which is a little concerning, and then also worsening, a 3% worsening. That's the opposite of improvement, right? If you take it for late treatment. So, Paxlovid's kind of a disaster, frankly. It really doesn't work. Ivermectin, on the other hand, very clearly works, and we have a lot of cumulative evidence showing that. And really, these numbers have changed maybe by 1 or 2% since there were 28 studies, which is when we started employing ivermectin in the practice. So, very strong evidence basis for what we're doing. It's not, this is not horse paste and not hand waving. I mean, this is evidence-based medicine. So I just want to make sure that's clear. What else? Well, I want to get back to what our offerings are so that people can know, okay, now what do I do? I'm convinced I need to be ready to treat early, day one of symptoms. What are my options? So did you want to
Okay,
go?
well,
Yeah.
if you're new to the practice, it's the COVID prep package. The investment
Well,
is
there's two ways technically. If you're new to the practice, there's two ways because they could either join the wellness plan and add on the unlimited COVID care, or they could do the COVID if they just want to do the. So maybe distinguish those two options.
absolutely.
Yeah.
Okay, so there are two options. If you're totally new to us, you can, one, purchase the COVID prep package, which will have you at the ready, for treatment on day one. And the second option is that if you are a wellness plan patient, and there's another podcast episode where we talk about, what is our wellness plan? Why would you want to be on it in the first place? I think the answer in short is, there's so much, our system is based on reactive medicine. Like if you really want to thrive and have a life of aliveness and alacrity and be on the lookout for some big things that you may be dealing with health wise, and catch it early, like cancer, autoimmune disease, the wellness plan is for you. It's just absolutely so comprehensive. So our wellness plan patients can pay an additional one-time $395, and we will provide you with unlimited lifetime care of active COVID, as long as you're on the wellness plan.
Right. So just to be clear, that's in addition to the normal wellness plan charges, not,
Correct.
it's not standalone. It's like an add-on,
Yeah.
but it is unlimited. As long as you remain a wellness plan patient, you will have access to us for either a COVID or monkeypox or bird flu or whatever comes down the pike. Right.
Yes.
Yeah.
So is that clear to you? So
It's clear to me.
you on board as a wellness plan patient,
Mhm.
for the initial investment of $595 and $99 per month thereafter. You have an opportunity to purchase lifetime treatment of active COVID for a one-time $395.
Yeah.
Yeah.
So I just want to do the math so we can sound like we know what we're talking about here. So it'd be $990 if we add the $395 plus the $595. It's a total of $990 to get started. So, and anybody who's currently a wellness plan patient can add that on at any time. Now, of course, we may increase the price as inflation continues to rise, but we're not going to go back and, charge anybody who's already paid any extra. Once you've added it on, you've added it on, right?
Right.
Yeah.
Okay, so that's if you're new to us. If you've already purchased a COVID prep package in the past or have been treated by us for active COVID.
Hold on, before you talk about that, we
Okay.
need to talk about the COVID. If you don't want to be a wellness plan patient, you're like, I've got a great holistic doctor that I work with that, I'm doing thriving under their care, but they don't do COVID, right? Then we have the COVID prep package as a standalone option, and talk about that for a
Yes,
second.
which is a one-time $395, or each time. The investment for the COVID prep package is $395, and you get treated for up to 30 days. We'll ensure that, you get to 100%.
Now, just to be clear, when we say up to 30 days, we mean until you're well, up to 30 days, whichever comes first. Usually it's you're well.
And for anybody that's been treated by us before for active COVID, and for anyone that has purchased a COVID prep package previously and used it, the next time you purchase one, it's $100 off. So the price will be.
Well, just to be clear, sorry, I feel like I keep interrupting you, but I want to make sure we're super clear. If you renew your COVID prep package within the 30-day window of treatment, or we're currently offering, and because we're just started this, where we're giving the $100 discount for renewals. So we're offering a 30-day window right now for anybody who we've previously treated for COVID or who's previously purchased a prep package, where they can go ahead and renew their prep package or get a prep package to cover them for the next time they get COVID for $295. If you're a new patient to the practice, it's still $395 the first time, but then after that, you'll be eligible for the $295 renewals as long as you renew it during that 30-day window after when you actually get COVID. So that's kind of how it works. Does that make sense?
Yeah.
But I will say that in addition to the core medications for the FLCCC, that there are other medications, like let's say you need cough medication or antibiotics in case you get a secondary bacterial infection. All of those are included in the care that you receive as part of the COVID prep package. So as we're following you and getting daily check-ins about symptoms and vitals and all that kind of stuff, if in my estimation, you would benefit from additional medications, I'll go ahead and prescribe them.
All right, option 3. For those who want to put the focus on prevention, we do have a Preventive Plus membership, which provides you with unlimited refills of ivermectin and unlimited refills of hydroxychloroquine. You also have access to our monthly calls with Dr. Ryan, where you can ask, any questions that are there for you regarding regarding COVID or the protocol or how to use them and such.
Yeah. And each refill includes 90 days of preventive ivermectin. So that's 26 capsules of the 0.2 milligram per kilogram dose. And then for HCQ, we do 10 days at a time which will either cover you for two post exposures or for one round of treatment. And so for people who are, really looking for, I want to focus on prevention. Every time I feel just the littlest bit of tickle of maybe symptoms, I want to go ahead and do 5 days of prevention. Anytime I get exposed to somebody who has any kind of URI symptoms, I want to do prevention. Anytime I'm traveling on an airplane or, in cramped quarters with people who may or may not be sick, I want to do prevention, who want to be really proactive with the prevention. Or I was around my cousin or sister or whatever who was sick, and I'm like, I don't know what they have, and I'm not going to take any risks, or I'm going to go be a caretaker for somebody who's dealing with symptoms, and I want to be on preventive during that process. This program is for you, right? This is like, I want to live my life, but I want to have access to HCQ and ivermectin, how much ever I need, whenever I need it, so that I'm not worried about, am I going to be able to have that available when I need to use it.
I would emphasize the access to you, on those monthly calls. I think in the very beginning of the pandemic, you had a lot of do-it-yourselfers, with the whole horse pace thing, and it just gave, it really caused a ruckus, and gave people ammo, to really.
Well, you a ruckus, you mean in the country, right?
Yes.
Yeah, I know, absolutely. It turned COVID into a political issue. It became like something that divided families, divided friends.
So do it in a guided way, a way that is
based on the latest and best evidence.
Yes.
Which unfortunately a lot of doctors can't do. We've talked about this in other podcasts, but just to reiterate briefly, 70% plus of doctors work inside of hospital systems where they do not have the freedom to practice medicine anymore. They're limited in terms of what they can prescribe for what. They can't prescribe drugs off label. These medications will never get FDA approved for these indications because they're off patent, they're generic. And there are trade name drugs that have been approved for the treatment of COVID. They don't work, but they've been approved because our FDA has become totally corrupt, and we'll talk more about that, I'm sure, in other episodes. But I would just say the important piece is to find someone who's in private practice, who's COVID aware, and is willing to, is aware also of the best evidence. The FLCCC protocols really are based on the latest, best evidence for the prevention and treatment of both COVID as well as long haul COVID syndrome.
You have no strings on you, husband.
Yes. So, Pinocchio reference for those who aren't as much of Disney fans as we are, or at least Disney up until about 2017. I always say Coco is the last good movie that they made. But anyway, it is what it is. Yeah. All right. And we do still have also, for people who waited, we still have acute COVID care for people who are like, hey, I have a friend or cousin or family member, whatever, who's sick and they're not getting better. And
didn't anticipate that it would, be this bad. We have the option for acute COVID treatment.
And that starts at $395 and goes up depending on how many comorbidities and how severe their symptoms are.
Yeah. And if we have to jump you from the hospital.
Yeah. And we have a standard preventive package as well, which really is access to the same calls, but it's just for people who need ivermectin for prevention. Maybe they can't take HCQ like my wife. We have that as well. And that's also an option. And they can also, I think that's
all those links to these offerings will be in the show notes.
Great.
Yeah.
All right. Anything else you want to say about in this COVID update and review of what we're doing about it?
Anything you want to say?
Well, do you have any other questions for me? Any questions that you think that we haven't touched on?
We touched on why you wouldn't want to do it yourself. So a lot of the countries, I feel, are doing that.
Well, I wouldn't say not even just doing it yourself. I think the issue is don't think, I'll take some vitamin C and I'll be fine.
Yeah,
because you may be fine for like the first 15, 30 days. You may even get to 100% and feel better. And then 2 weeks later, new symptoms emerge. And you're like, what the heck happened?
Yeah.
Right? Why do I have long COVID now? I thought I was better.
So the email that I just read, the gentleman that shared, he got Pfizer shots and has never felt the same for 3 years. It's the same for another gentleman, similar age, that has had COVID 4 times. And he's presenting with a lot of the same symptoms. He's brain fog and heart issues. And
was he vaccinated?
No.
Yeah. And so I'm so glad you brought that up, because that was the next thing I was going to say. Is that just, there's people that we've encountered who think, I didn't get vaccinated. There's no way that I could have long COVID, as if that somehow makes you immune from long COVID not to have been vaccinated. It's not correct at all. It has to do with genetic variations and HLA haplotypes, which we're still trying to figure out. The sort of genetic variances in the immune system. We've absolutely seen people with very high anti-spike protein antibody titers who were not vaccinated for COVID. We've absolutely seen people with long COVID, long haul COVID syndrome who are not vaccinated for COVID. We've absolutely seen people with long COVID who we treated for the first 2 times they had COVID. And then the third time they thought, I'll go it alone. And then they got long COVID, right? So really, I cannot emphasize enough the importance of early treatment with this disease. And frankly, given ivermectin's efficacy against pretty much any RNA virus, given hydroxychloroquine's efficacy against, as a zinc ionophore, which is, again, going to help against many viruses. Zinc is virucidal. It kills viruses. I really personally advocate for early treatment. If you don't know what you have, go ahead and treat. And whether or not you've tested or not. I don't even think that that's, as Dr. Merrick likes to say, COVID is a clinical diagnosis. And he also says, assume it's COVID until proven otherwise. Right. So I can just tell you anecdotally, we have had in the last couple of years, we have 2 young kids. So we've had a bout of RSV, we've had a bout of flu, and both times I was treating early for COVID and I had the fewest symptoms out of anybody else in the house because I was on these medications, which even though they didn't completely get rid of it like they would have with COVID, they helped. And, like for example, with the flu, you were not able to take HCQ. I had zero body aches. You had horrible body aches. I mean, I feel like I'm picking on you a little bit tonight, but I
No.
think the point is that it's, being on these medications absolutely makes a difference, regardless of what kind of viral infection you're dealing with. Now, if you have a bacterial infection, obviously, that's when you may need an antibiotic. But go ahead. If you have a bacterial infection, then obviously you may need an antibiotic. So it's not going to work against every infection. It's not a panacea. But certainly for most upper respiratory tract viral infections, this protocol will be effective to some degree. And, then we have separate protocol. FLCCC has a separate protocol for RSV and flu, at which point we bring in elderberry extract, which actually works better than Tamiflu with fewer side effects against the flu, also helps against RSV. We bring in high-dose N-acetylcysteine. We add S-acetylglutathione in there as well, because those really help with RSV and flu symptoms as well. So, we've been using a lot of these interventions for, 2 decades plus, and a lot of them are part of the standard naturopathic armamentarium, but they've now really been codified with the evidence basis and by the number one most published intensivist in the world, Dr. Paul Merrick, as part of the FLCCC protocols, which really I think validates what we've been doing naturopathically for decades. What's your
What
question?
would you say to the groups of people that are of a holistic mindset, perhaps, spiritual, holistic, zero pharmaceuticals? Like, is it possible to treat with zero pharmaceuticals?
It is. We've actually had some good outcomes. There's people who just fundamentally feel in their essence that it's like an out of integrity for them to take any drug, even though ivermectin really is more of a semi-synthetic, really. It's derived from a soil bacteria. It's more of like a parabiotic. It's not, it's statistically safer than aspirin, which is derived from white willow bark. It's safer than Tylenol. It's the safest drug in the armamentarium as far as I'm concerned. But some people just feel like, hey, I don't want to do anything even, made by any pharmacy whatsoever. I only want to take natural medicines. And we've done, I really pioneered that approach in pregnant women because I feel most comfortable really sticking with natural medicines only during pregnancy. And so we've had some really great outcomes. We've never lost a baby, and we've never had a woman who didn't recover from COVID pretty quickly. And so then we've employed that same protocol with people who were just very opposed to any drug treatment, and they also have done pretty well. And we haven't seen it, we have to do it with, it's more intensive, so when we can bring in the ivermectin and HCQ, we don't have to do quite as many natural things, which of course, sometimes the natural stuff can add up in terms of price. But for people whom, that's not as big of an issue, absolutely, we can lean in with that. And there's some really great natural medicines out there. And we pull out all the stops and use the whole toolkit of natural medicine. And then we get some pretty good outcomes. And even for long COVID, I've even had some patients that I treated for long COVID who said, I'm not going to do the ivermectin. I don't want to do low dose naltrexone. I don't want to do any of the, the mainstays. And I try to, convince them to do it. But, sometimes people are just really adamant. They're like, well, I want to try it. And we've seen pretty significant reductions. I mean, thousands in terms of the units per milliliter of these anti-spike protein antibody titers come down several thousands just using the natural therapeutics. So we've seen some good outcomes for sure. And I'm totally sympathetic and understanding of people who prefer to do things 100% naturally. And I always say, look, we're happy to give it a try, and just request that if you're not getting the kind of results that you hope to get, don't throw in the towel. Let's just, maybe we'll revisit the question of some of the safest pharmaceuticals known to man if you don't get the outcomes that you're hoping. But so far we haven't had to do that. Actually, we've had some pretty good results. So the healing power of nature, right?
Yes.
Yeah,
It's
it's a beautiful thing.
it's an extraordinary thing. All right. Well, thank you for listening to this episode of the Partovi Effect, Creating the Consensus. And we have added a tagline to what the podcast is about. And
We have. This is
yes,
news to me. I didn't know.
it just so that our audience would know, what you're listening to, what you're getting, and that you're clear about it.
Oh,
So
I think
I
I
wanted to come out strong, so it's the tagline is navigating the sea of disinformation, exposing the lies in healthcare, education, and politics.
Yeah, this reminds me of that quote that I sent you in the text. So this is a text that I sent you about 2 months ago. And I don't remember exactly what had been going on at the time, but I keep coming back to it because to me, it really captures the moment we're in and the importance of the mission that we're on.
Yeah.
It says, I am present to that we need somehow to teach our children that they live in a world and a society that is slowly and inexorably going insane. And their goal, as in our children's goal, right, is to stay sane, reject the insanity whenever and wherever they see it, and propagate their sanity, which we impart to them and help them to safeguard to the next generation, keeping in focus the importance of maintaining their integrity of thought and belief, reason and faith, regardless of the madness going on around them. So, our hope and our goal, our intention is to include you in that same process of imparting sanity. That's really the intention of the podcast in a few words, is like imparting sanity in an insane world, right?
Amen.
And the same imparting of sanity that we give to our kids, we're also offering that to our community. So thanks for being here and letting us contribute that to you.
Absolutely. See you next time. See you in the practice. Be well.
I've been Dr. Ryan Partovi.
And I'm Mrs. Madi Partovi.
Be well.